Alzheimer's affects many families in Louisiana. Advocates will soon release a new report and speak with lawmakers about dementia. Dolores Hurst is the executive director with the Alzheimer's Association Louisiana Chapter. She's here to give us some of those details. Thank you so much for coming in this morning, Dolores. Let's start with this new report, this new data that you all are coming out with. The report is tomorrow. What have you all found?
Yes, so the facts and figures report is coming out tomorrow from the Alzheimer's Association. So our facts and figures always give a statistical analysis on the numbers that affects Alzheimer's and dementia patients nationally. So it breaks down caregivers care, the amount of cost associated with caregivers care, and also how many the prevalence data attached to Alzheimer's disease and diagnosis as well. And it breaks down that data nationally, but then it breaks it down even further statewide, and then parish-specific data and prevalence data for Louisiana as well.
Where do you see Louisiana ranking when it comes to that report?
So in 2024, so we don't have the data for 2025 yet for Louisiana, but for 2024, the data showed that New Orleans was 10th out of the nation. The city, the Orleans Parish was 10th out of the whole nation as prevalence. There was 15% of those 65 and older that were diagnosed with Alzheimer's. So wow. That's the 10th parish, yeah. What
would you say is the biggest challenge for families dealing with Alzheimer's?
The biggest challenge is, in my experience and the time that I've been in this role, has been access. Access to care, access to all the knowledge and stigmatization of care, and it being at their fingertips. A lot of my volunteers and a lot of my advocates would say that if we only knew when we were going through the process, if we only knew at the early stage, if we only knew how to advocate to our medical doctors or to our practitioners, if we had access to gerontologists, if we had access to neurologists who knew how to diagnose, we could have gotten a lot more help earlier and faster.
And part of that reason why you all will soon have an advocacy day at the state capitol. Tell us a little bit about that.
Yes, so Advocacy Day is May 6th. It's going to be at 9 a.m. We do it every year, and we always have an ask to our legislators. It's very important for us to advocate so that Alzheimer's and dementia can be a public health priority. We built an infrastructure last year with our advisory council so that it can be a public health priority, and we have a partnership with Well Ahead and the Louisiana Department of Health for that advisory council, and the governor's office has been a great lean in and a great partner with us as well. We're getting that advisory council established, and now our ask this year is for us to have a dementia care specialist program where we can get 8 dementia care specialists within our area on agings so that they can actually get resources to the caregivers faster, so they can help with getting care, getting practitioners, getting diagnosis earlier, getting earlier detections, getting care, and all of those things, the resources that they need.
Where can families go for more information if they want to learn even more about the resources that you all currently do provide for families?
Yeah, they can always call our 24/7 helpline at 1-800-272-3900, or they can visit our website, www.alz.org.